I'd like to talk to you about applying the Synera patch. This patch may have been prescribed to you or at least offered to you by your healthcare provider just prior to giving your injections. If you particularly have a fear of needles or if you're worried about one of the injections hurting, this patch may be a good alternative for you. To do this, you first want to take the patch out of the package just by opening it up. And it looks just like this, kind of like a big bandage. And there's a little opening right here where you can pull the patch off of the outer backing and apply it directly to the area, the sticky side directly to the area where you're going to give the injection, and it'll just stick to the skin. In most cases, it's for progesterone, and you're just going to apply this directly to your hip. This part right here is medicated, and it will feel warm to the touch, and it numbs the skin down deep so that the injection will be fairly painless. It's important that you apply the patch about 30 minutes before you take the injection. When you're ready for your injection, you simply remove the patch, wipe the area with alcohol, and administer the injection. You may continue to feel a little bit of warmness or a little bit of numbness for up to an hour later.